Hi guys, welcome to Anatomy Snapshots. These are short videos that will help you understand concepts to help you pass your anatomy at a glimpse. Okay, and so today we're going to look at the renin-angiotensin system. Today, we're going to look at a system that helps to regulate the blood pressure. We're going to help to look at homeostasis in relation to blood pressure in the human body and what exactly is involved for the human body to maintain this blood pressure. First of all, let us look at the main organs that are involved in the control of blood pressure. So first of all, we have the kidney. The kidney is involved in the formation of this enzyme known as angiotensinogenase, or the other name is renin. Okay. And the second organ that we're looking at is the lung. This lung is involved in the formation, in the production of angiotensin converting enzyme. All right. We have endothelial cells that are specifically found in the lungs that produce angiotensin converting enzyme. The kidney, on the other hand, has specific cells known as juxtaglomerular cells that are found in the afferent arterioles of the kidneys. And these ones are the ones that produce renin. And then we have the hepatocytes in the liver that produce angiotensinogen. This is a hormone, okay, which is proteinous in nature. It is produced and then secreted to circulate in the body. And then we have the adrenal gland. The adrenal gland are the ones that are going to produce a hormone that is known as aldosterone. And then we have the blood vessels, which are eventually going to be the target organs, okay? So now let us go ahead and look at exactly what happens. First of all, we have this afferent artery. We have, first of all, we have this renal artery that is taking blood to the kidneys. Now, once the patient's blood pressure drops, that means that the kidneys will not receive the enough blood. Okay, blood pressure can drop due to many reasons. It could be that the patient has been bleeding. It could be anything. Anything can drop the blood pressure. Once blood pressure reduces or drops to a subnormal level, the kidneys are going to interpret that as something abnormal, and therefore the juxtaglomerular cells in the afferent arteries are going to produce angiotensinogenase. Angiotensinogenase will be released in the bloodstream, and it is going to meet angiotensinogen. Angiotensinogen will be converted from angiotensinogen to angiotensin 1. Okay. Once angiotensin 1 is converted to, once angiotensinogen is converted to angiotensin 1 by this angiotensinogenase, it is going to be circulating in the bloodstream, and it is going to meet up with angiotensin converting hormone and with angiotensin converting enzyme. Angiotensin converting enzyme is going to further convert, okay? It is going to convert angiotensin 1 to angiotensin 2. Angiotensin 2 will continue circulating in the blood, and it will go to the adrenal gland, and it will stimulate the adrenal gland to produce aldosterone. Aldosterone. Now, before we go to aldosterone, one of the functions of angiotensin 2, it goes directly, first of all, to the blood vessels, and causes vasoconstriction. These are peripheral blood vessels, and once the peripheral blood vessels are constricted, it means blood pressure is going to rise. The second function, like we already said, this angiotensin 2 is going to go to the adrenal gland, and it is going to stimulate the secretion of a hormone known as aldosterone. Aldosterone, once it is produced, it is going to act on the renal tubules. The renal tubules are the ones that will help. They are the ones that promote the reabsorption of water. Okay, so once urine is produced in the glomerulus, these renal tubules, there's the urine that is filtered from the glomerulus. That filtrate is not yet urine, but as it is flowing through the tubules, the body itself has a regulating mechanism which allows for some water to go back into the bloodstream. Some substances, not only water, some substances go back in the bloodstream. There are some things that are not supposed to be in the urines. For example, sugar will go back back. If there's any sugar molecules, it will go back to the bloodstream. If there is too much water in this filtrate, it will go back to the bloodstream. Several things will go back to the bloodstream. Now, in a person who, when the angiotensin converting, when the renin-angiotensin system has been activated, that aldosterone is coming to work on these tubules, on these renal tubules, and it will increase the reabsorption of sodium from the renal tubules. Once the reabsorption of sodium has been increased at the renal tubules, it means even water will be reabsorbed back into the bloodstream. Therefore, we are saying that there will be reabsorption of water and sodium chloride from the renal tubules. And this sodium chloride will then go back into the bloodstream. This water will then go back into the bloodstream, and this will then result in an increase in blood pressure. So two mechanisms will eventually happen. The blood vessels are going to be constricted by angiotensin 2, and there will be reabsorption of sodium and water at the level of the renal tubules, and these two things are going to help in raising the blood pressure. So that is the concept of the renin-angiotensin system. Bye.